There's numerous ways that laser therapy can affect the body in a positive way. And what's really neat is we keep discovering new ways or new mechanisms of action that, with light therapy. And it's pretty fascinating.
Hey, VetFolio voice listeners, I'm so glad that you have tuned in for this episode. This episode is sponsored by K-Laser and features Dr. Ryan McKenzie, who joined me to talk about what else? Lasers. And who doesn't love talking about lasers? That's right, we're getting into light therapy, the different indications from control of inflammation to enhanced wound healing to infection control, all kinds of things. Now, I'll be honest, I don't have a ton of experience with laser therapy, with light therapy, so I had a lot of questions going into this one, and Ryan was great. He had a lot of information, and several times I felt like maybe I was asking kind of a very basic, silly question, but he never made me feel that way, and he had great answers, so I learned a lot from this conversation. So whether you're very comfortable with light therapy and you're just wanting to learn more, or you're more in my boat where maybe you don't know a lot about light therapy and this is kind of an intro for you as well, I think there's something in this talk for everybody. So without further ado, let me go ahead and introduce Dr. Ryan McKenzie, and let's talk about lasers. Dr. Ryan McKenzie is the U.S. Animal Health Clinical Training Manager for Indiba K-Laser USA. Prior to assuming this role, he spent 5 years in the veterinary pharmaceutical industry as a professional services veterinarian, holding roles within the U.S. Inside Sales Department as well as in the field covering the Delmarva, D.C. region. Before transitioning to industry, Dr. McKenzie practiced for 13 years as a small animal general practitioner, primarily in Delaware. He earned his DVM from the Virginia-Maryland College of Veterinary Medicine in 2006 and completed an internship in emergency and critical care and internal medicine at VCA Veterinary Referral and Emergency Center in Norwalk, Connecticut. Dr. McKenzie is deeply committed to veterinary education and research with particular professional interest in dermatology, internal medicine, and multimodal pain management. He resides in Wilmington, Delaware with his wife, a licensed veterinary technician, their daughters, and their energetic golden retriever, Molly. All right, let's go ahead and get into it.
In the age of Dr. Google and conflicting influencer advice, it's important to follow the evidence. That's why the NAVC publishes free veterinary journals for every member of the veterinary healthcare team. Subscribe to Today's Veterinary Practice and Today's Veterinary Nurse for evidence-based clinical insights. Or check out Today's Veterinary Business for practice management guidance and deep dives on the latest industry trends. Visit navc.com and hit the Publications tab to learn more and subscribe today.
All right. Well, in this episode, I'm joined by Dr. Ryan McKenzie, and we're going to talk about light therapy. I really like this topic because, I don't know, I think any avenue that we can explore to just increase therapeutic options for our patients is really exciting. And I feel like I have a little bit of knowledge about light therapy, but emphasis on the little bits. So I'm excited to learn more. Thanks for joining me.
Yeah, thanks for having me. I really appreciate it.
Yeah, I'm excited to get into this. I guess, starting with the very basics, because of course I know this, but for those out there who don't, how does light therapy actually work?
Yeah, happy to share. And I think before I explain how it works, did you know that laser was actually an acronym?
Well, I did know that. In case anybody didn't pick up on like the dripping sarcasm in that first question, like that goes back to the emphasis on the very small amount that I actually do know about light therapy. Um, I can't remember what it stands for, but I did know it was an acronym.
Right. Yeah, it stands for light amplification by stimulated emission of radiation. So
Yeah, I never would have
pretty
gotten that.
fancy. So lasers, short, cut and dry. So what we do with lasers is we take a concentrated beam of light at a specific wavelength and we shine that on the affected area of the body. And there are molecules inside the body throughout called chromophores. There's various types, but they each absorb at a different wavelength. And from there, there's downstream signalings to exert a biologic effect. And we call that photobiomodulation. And basically, we are using light to modulate or have an effect on the cells and the tissues.
Interesting. I have heard the term photobiomodulation, and that like it does make sense to me how we're affecting these chromophores, and then that will influence physiologic processes. I'm kind of I don't know, and this is probably the wrong way to think about it. I'm thinking of like stimulating photons, and isn't it like as they release energy, then that's where we have an effect. Is it a similar sort of process that
It
we're creating?
It is, and I'll tell you there's a lot of physics involved, and so I would just say, anybody that's just learning about lasers, brace yourself if you're not a physics person, but once you get over that learning hump, it's real easy to go from there.
Yeah, as I was saying, about, stimulating photons and things, my mind immediately went to, like, I had a little moment there because physics was not physics 1, I could do all day long. It felt like that was just a lot of math, and I was good at that, but man, when we got into, electrical energy and that kinda stuff, it was not my strong suit. So, yeah, I was already getting, like, a little bit of a shiver even asking that question.
I'm right there with you, Cassie, and I always say that if I could figure it out and do it, anybody can do it. Trust me on that.
That's encouraging, that's encouraging. I feel like that's a tall hurdle considering my physics experience, but it does sort of make sense. It sounds like we're almost, like, creating energy of some sort within these tissues, and then what sorts of physiologic effects is that causing?
There's a variety of physiologic effects, and different wavelengths can stimulate different physiologic effects too. So, the most common applications would be decrease in inflammation. So, it has an anti-inflammatory effect. So, it's used frequently for arthritis, for wound therapy as well, but also analgesia, pain relief. I mean, that's at the forefront. And when we talk about arthritis, we talk about multimodal pain management. I mean, laser really has its place, not just in those end stage cases, but I would argue early on in those cases. Laser therapy can also have an antimicrobial effect. It can be antibacterial, antifungal as well. There's numerous ways that laser therapy can affect the body in a positive way. And what's really neat is we keep discovering new ways or new mechanisms of action that with light therapy, and it's pretty fascinating.
And when you're talking about anti-inflammatory versus, say, like antimicrobial, I know we're talking about using specific wavelengths for specific purposes. Are we talking primarily like red light therapy in all of those applications? Or are we getting into, again, I can just scratch the surface with my knowledge. And I know I've heard like blue light therapy with antimicrobial. Is it just by reducing inflammation you get antimicrobial effects? Are we getting into too much physics to
No,
get into that one?
I think it's great, but as long as we throw some biology in there, I think I'm good.
I love
Yeah.
that. Yes.
So we work with in the red and near infrared spectrum of light and also the infrared. So we can't see all of the light that's being utilized. But it's really interesting. We work along that spectrum of light, but you mentioned antibacterial properties. Actually, a lot of bacteria have chromophores within and porphyrins and whatnot. And so the laser therapy can impact that and cause a burst, like as what am I thinking here? Radical. Oh my God, what's the
Free
word?
radical scavenging?
Free radicals. Yeah, there we go. Yeah.
You know something. There is some biology in there.
Yeah, but it works through the porphyrins basically, and it causes the bacteria to rupture and can have an antibacterial effect there too. And the same goes for yeast and fungi as well.
And it's specific to these bacteria. So, like you said, we're causing these to rupture, but not having that same effect on the animal tissue.
Correct. Yeah, correct. And
Interesting.
and it's been showed, like the 970 nanometer wavelength specifically can disrupt biofilm. So, when we think of some of those animals that have those nasty Pseudomonas ear infections, they form that biofilm. So laser therapy can certainly help reduce that biofilm.
Interesting, interesting. So, I guess we've kind of touched on this a little bit, but maybe getting in a little bit more specifically, what are some opportunities? You mentioned these ear infections, more specifically to use light therapy, to use lasers to augment how we're managing cases that we're seeing pretty regularly.
Sure. Yeah. The advice I would give is don't try to do too much too fast because you can really overwhelm yourself trying to think, can I use a laser for this case? Can I use a laser for that case? I think if we start simple, start with the cases you're seeing. Otitis externa, for example. If we start with just a couple of conditions, and get in that habit of using lasers, then, you'll really be able to expand it beyond the common things that you're seeing. So I know hot spots are really common. I practiced 14 years, so hot spots are common, allergies, atopic dermatitis, but also OA as well, osteoarthritis. So, I think that when we talk about multimodal pain management, we sometimes tend to forget some of these modalities, but lasers right there at the forefront. And again, is can really, really help augment the treatments that are already in place.
And so if we're thinking, say dermatology, for example, otitis externa, um, how would we go about something like that? Do we get the benefit off of just like a one-time treatment, or is this something where, it's beneficial to have owners come in several times throughout the management of otitis or hot spots or whatever it may be?
Yeah, great question. There are some cases where single treatment is beneficial, and I actually have an example. There was a lab that had a hot spot behind the neck that was site was clipped up and just got a saline rinse, and then it got a laser therapy, no topicals, no other therapy at all, and within 3 hours there was a dramatic reduction in the inflammation, and so that was with a single utilization of the laser. Certainly, some of your more chronic conditions are gonna need a maintenance therapy afterwards, but there are some of those indications, like post-surgical cases, incisions, for example. I mentioned hot spots, that yeah, some of them may need multiple sessions, but you can really get bang for your buck just by doing a single treatment, even while that animal is, say, recovering from anesthesia. You can laser right over the incision.
Yeah, yeah, actually, I the hospital that I relief for, does exactly that, is we'll do the laser therapy after, postoperatively in a single treatment. Is there in those cases, are we gonna see benefit if we, say we have an owner who has a really active dog and they're like, "This is gonna be the longest 2 weeks of my life," which I respect because
Mhm.
recovering from spays and neuters, is no joke. And, they say, "I really wanna try to speed this healing along as much as possible." Would there be benefit to saying, "Okay, come back and do multiple laser treatments," or would we maybe just heal up the skin in that case and not and still worry about the deeper tissues? That might be too specific to really say one way or the other.
No, I think it's great. I think some of the immediate things that you can see with just a single treatment on some of those post-op cases, even post-dentals as well, and the gingiva, is a reduction in pain is one of the first things that's seen, but also a reduction in inflammation as well. And so, yeah, many of those cases would benefit ideally from multiple sessions, especially during the first 2 weeks or so. But that said, you can see those immediate effects with just a single session and make that animal more comfortable. And hopefully that dog is getting back to normal, not too back to normal over the 2 weeks, because we know the
Right.
importance of exercise restriction, but the big thing is comfort and comfort for the animal. And I think that is so paramount that, again, a single session can do that.
Yeah, and I think that's really helpful to say, yes, like, it might benefit from multiple sessions, and, of course, we do want to maintain that exercise restriction and things like that, but even doing that single session is helpful, will help that patient be more comfortable, and then however that specific management plays out for the patient, the goal it being to reduce complications, to say, let's still try to make it out to the 2 weeks, but let's give ourselves the best possible chance of getting this to heal up and, maybe this crazy puppy that just doesn't wanna sit still.
I'm looking at one right now.
Ah, yes, mine is sleeping under my desk, and I'm happy she's sleeping 'cause yeah, once she's awake, then it's on, then I don't know what's
Uh-huh.
gonna happen.
Yep. Understood.
What kind of puppy do you have there?
She's a golden retriever,
Ah, I love a
and
golden retriever.
she's sweet. We're glutton for punishment. We're getting a second one here at the end of August. So
Yeah, yeah, I know, I can relate to that, I'm a 2-dog person, I have a lab and a boxer, so same, just energy galore all the
yeah,
time.
you gotta love them.
Yes, yes, yeah, these are the ones I'm thinking of with recovering from spays and
Mhm.
neuters of going, when owners say, "This is gonna be really challenging," I say, "Yes, yes, it is, and I will do everything I can to help you, but it's gonna be a long couple of weeks." So, I think that gives us a really good idea of some of the more common cases we're seeing: hot spots, ear infections, post-surgical, post-dental. What about maybe some of the disease processes that we may not think of? And say we get comfortable in those more common cases, and we want to expand our use of light therapy in our practice.
Yeah, great question. I think I like to say that anything that has an itis with it generally there's an indication for laser because of that anti-inflammatory component. But we're getting more and more research and studies being done on internal medicine uses. Pancreatitis, for example, dogs and
Huh.
cats. It's been shown that we can reduce some of that inflammation, provide comfort. And yeah, there's still other treatments, your mainstay treatments, but maybe that animal's comfortable enough and then maybe the inflammation's calmed down that maybe that animal goes home a day earlier, and how important is that, for many reasons why. So certainly those inflammatory conditions. Another one I think about is those feline lower urinary tract cats. Fluted or FIC, I don't know what the terminology is that,
Oh, I
I've
think
been
it
able to.
varies depending on who you ask.
Yeah, but we can see dramatic increases in comfort there. And, the bladder sits, just right there underneath the body wall. So those types of things, we may not think about so much. But again, I think it's as long as it's not the eyes, if there's an itis associated with it, we can really see bang for the buck by using a laser. And the animal's right
Interesting.
there too in the hospital. So, you can do multiple sessions if they're at your hospital.
Absolutely. Well, and I'm thinking of, say, a pancreatitis case. Sometimes we don't have the opportunity to hospitalize those patients.
Yeah.
We have outpatient or we have nothing, and
Mhm.
that can be difficult depending on the severity. And managing pain in an outpatient way can be one of the hardest things with pancreatitis. So, even if we can just kind of augment that pain management a little bit by using laser therapy, I think that could be huge in some of those cases that we can't hospitalize.
Yeah, absolutely. And I tell you, another thing comes to mind is the cats with the chronic gingivostomatitis,
Hmm.
and we know that generally it's full mouth extractions for
Hmm.
for many of these cats. And hopefully that improves. But we have studies done, and there's one ongoing now in Europe looking at those types of cats and using laser therapy. And the results are pretty dramatic that we're getting a dramatic reduction in inflammation. And we have before and after photos on a group of cats. And it's incredible. Now, granted, these cats are coming in multiple times to get this because it is a chronic condition, but the results are incredible. And like I said, they're less painful. They're eating more, and yeah, maybe ultimately full mouth extractions may be required, but maybe not if we can keep things at bay. There's a lot of different modalities coming out for that specific condition, and laser therapy is one of them.
Interesting. And when you say a dramatic reduction in inflammation, is that in cats who have had full mouth extractions, who haven't, or kind of a combination of both?
Yeah, great question. The study that we did, the cats did not have full mouth extractions.
Interesting, interesting. Because yeah, sometimes, when you say that to a cat owner and you say, full mouth extractions, it can kind of be a shock. And so if we like you said, we may end up there anyway, but it might be something that while we're having that conversation and kinda navigating what the right therapy is for this cat to reduce that inflammation, keep this cat eating, make them more comfortable, avoid full mouth extractions in an ideal world, and
Absolutely.
just, I think it goes along the lines of where we started in this conversation of just giving us more options.
Yeah, and the nice thing about it too is yeah, the laser devices generally are very versatile, a lot of flexibility. And so with our laser, for example, we can treat right at the gingiva with the patient anesthetized, or if they're really good cat, you just hold their mouth open. But if not, we can also go outside the cheek as well.
Okay.
We can alter our settings and go outside the cheek and get positive results that way too.
And actually, that brings up the next point I was gonna ask you because we talked about pancreatitis, fluted or FIC, and then this gingivostomatitis. I know that in some of these less common applications, we have to think about depth of penetration into the tissue. Is there I guess, how would we consider something like that? For example, in, like, a pancreatitis patient, who maybe is overconditioned, and so we have a layer of fat to go through before we can really get inside of the abdomen. Is there any sort of, like, guideline rule of thumb to say this is where it might be less successful, or is it kinda, like, it's worth a try regardless?
Yeah, great question. And I think, yeah, when you got to go through the body wall, you got to go through different layers of tissue to reach that target organ. In this case, of pancreatitis, what I like to do is rather than focus on the depth, like we're sticking a needle, and how deep is that needle going, I prefer to consider it like a waterfall effect. You're having that initial beam of light. It may not physically reach said organ, but as it goes through and it's stimulating those chromophores, it really sets off a chain of reaction. So you get primary effects, but then downstream, some secondary effects and even tertiary effects. And that's your reduction of inflammation, reduction of pain, for example. But the laser light itself does not have to physically reach that area. So that's a fantastic question. But again, it's a chain of events, for lack of a better term, that happens.
Yeah, well, and now that I say it, now that I hear your answer and I'm thinking about it, I think of adipose as kind of like a pro-inflammatory type of tissue. So maybe if we can reduce that inflammation overall, like you said, even if we're not directly impacting that organ, we can get those beneficial effects either way.
Yeah, and if I may, I'll give a not so subtle promotion for our new line of products. We have the Giro laser. It's three different laser devices, but all three of those have the 1064 nanometer wavelength that has been shown. We call it the Deep Voyager. That it reaches deeper tissue, and it also has the less scattering. Superficially, and so it's able to get past the barrier of dark skin, for example, the melanin, but it can go deeper and reach those target sites that are still causing that chain of reaction that happens as well. So I wanted to point that out because I think it's a pretty fascinating tool that we have and a nice feature with our
Yeah.
devices.
Absolutely, because I think that's a big question is, like, how deep, can this light penetrate, and how do we think about that when we're treating these cases? So to know, like, it can go deeper, it's not gonna scatter as much superficially, and I didn't actually realize that darker skin or that melanin was a barrier when it came to light
Mhm.
therapy.
Yeah, yeah, and so we have to take that into account, whenever
Yeah.
we use our laser, and we need to use wavelengths that are I call it jumping over the melanin gate, if you will, that are getting past that. And generally, when we use higher wavelengths, we're able to, get past that melanin. Because that's always a concern. If we're using a lower wavelength or we're not moving our hand across the animal too fast or fast enough, then you can cause heating on the area. So, definitely want to keep that probe moving and again use those wavelengths that can jump over that melanin gate, if you will.
Yeah, yeah, and actually, I'm glad you brought that up because I know that we do have to keep lasers moving when we're using them on tissue because we can cause heating. If we are trying to get, say, a targeted area like the pancreas or the bladder, is there how are we worried about thermal burns and things like that?
I think again, if we're using the proper settings, and again, that's another really nice feature of all of our lasers is that there are pre-programmed settings that you can alter if you need to, but they do take that into account. Is it a light coated animal? Is it dark coated animal? Our new Giro devices have is it a spotted animal, for example? And another thing we need to take to effect too, which you spoke on a minute ago, was body condition. And our devices, you book, is it a skinny animal? Is it an overweight animal? Is it ideal? And so, we take all of these things into effect, but, yeah, so you want to keep your hand moving all the time. And what I always say is, many cases the animal's going to let you know that it's too hot, but what if they don't? What if they have a neurologic condition? Maybe they can't sense that. So, we are the best judgment as far as is this too hot? And so when I'm scanning, I'm using my other hand just to feel that area. To feel, one, is the patient comfortable? Are they tolerating it? But also, is it too hot for my hand? Right. And in some of those cases, many of those cases, I won't put the probe exactly on the skin. I'll go off contact. All right. And that can minimize some of that thermal heat up as well.
Okay, okay. That's helpful to say, we can kinda use that judgment, and then we have options to minimize, thermal
Yeah.
damage or as somebody who loves teeth, that's one of my biggest fears is, like, a thermal injury because I'm like, we have water and we have heat, and we're trying to, keep those 2 things separate, but I always worry about, something coming back later with a thermal injury.
Yeah, and we also have there's some built-in safety measures too, with a number of devices we have, and one is if your hand is not moving fast enough, the handpiece will actually vibrate and tell you, "Speed it up," and if you don't, it
Okay.
it powers down the device to around 20%, and so that's, again, another safety feature that's built in, and also some of our handpieces have thermal, detecting capabilities, and so if the temperature is getting too high, we can analyze that, or sorry, we can see that. All right, then we know we need to make adjustments.
Interesting, interesting. So it's kind of that secondary safety mechanism
Yeah,
to help prevent these types of injuries. And you said that the Giro is three devices in one. So this could have like multiple applications, superficially and into some of these deeper tissues we might be trying to go for.
absolutely. Yeah, with Giro, there's three models, and we start with Giro Core that has three wavelengths, and we have Giro Elite that has four wavelengths, and then we have Giro Ultra, which has five wavelengths. And again, targeting especially some of those deeper tissues with the 1064 nanometer, which is on every device that Jira comes in. So that's nice. And The Giro Elite, Giro Ultra can also be used surgically. And I don't mean just lasering the incisions, but it can actually be converted to a surgical device.
Oh, that's
So it
cool.
has that modality as well, which I think is pretty novel, and it's actually pretty fun to operate too.
Yeah, yeah. So multiple wavelengths within one device and then, multiple uses and options for how much you're doing in clinic. Um,
Right.
yeah, that sounds like a lot of opportunity depending on if you're just kind of dipping your toe in the water or if this is something that you're using regularly.
Right. Absolutely.
I feel like, with any medical anything, whether we're talking medications or procedures or whatever it may be, we have to talk about contraindications. Like, where do we avoid? You mentioned the eyes, but where would laser not be appropriate?
Yeah, good question. So there's really three contraindications that we speak of, and the first is a pregnant animal, because we don't know, it hasn't been evaluated what is the effect that we could have on a fetus, for example. So that's one contraindication. Why take that risk? Um, that doesn't mean that a pregnant individual can't operate the laser. So a
Okay.
pregnant individual can absolutely operate the laser, and I would not shine it on on the belly. I'm
Sure.
required to say that. But that's one contraindication. Another would be uncontrolled thrombotic conditions. So if we have an animal that's really prone to bleeding, for example, or it's throwing clots, we need to be very careful. I wouldn't use the laser in those cases because we're increasing blood flow. Could we make that bleeding condition worse in that state, or could we cause, clots to travel and cause, like a PTE, for example? And then lastly would be the use of photosensitive medications or animals that have photosensitive skin. And I think doxycycline. I'm here in Delaware. We see a ton of Lyme disease, a ton of animals on doxycycline. And so while they're on a light sensitive medication such as doxy, we say don't use those because you do run the risk of heating up the skin too much in those cases. So if they're on doxy for 2 weeks, 4 weeks, whatever the regimen might be, I'd say not laser during that period, but wait until they're off those medications. So those are the absolute contraindications that we speak of. And there's a slew of other precautions, but I think it bears mentioning the neoplasia conversation.
Right. That was going to be
And
my next question.
yeah, and so what we say is, we don't advise lasering over a mass itself. All right. Because again, we're increasing blood flow, we're increasing energy. Might we create growth of that neoplasm, for example? We don't know. There's suggestions out there that that does happen. There's articles out there that says no, it doesn't happen. I'm a willy-nilly conservative on these types of things, and so for those cases, I would say probably not use laser therapy. But if it's an animal, say it had a mast cell removed on a limb, you know, no contraindication to use that elsewhere in that body of that patient, just not over the direct mass itself.
Oh, okay, okay, so it can still be used, just kinda stay away from that area.
Yeah,
That makes sense. Can I give you a specific example and ask if it would be appropriate in a patient like this?
I'll try my best.
Okay, all right, I won't hold you to it, don't worry. She's healed up, she's better, but I'm just curious, like, how this would've played out. So I had I'm in Florida, so luckily not a ton of Lyme disease, but we have snakes. And so I had a diamondback envenomation, and she did really well, but we did see sloughing in the tissue of her leg,
Yeah.
um, which, amazingly, like, a lot of times things end up looking really nasty, but these wounds, they do really well and don't need a lot of intervention, but hers got bad enough that she did. She needed
Mm.
a tie over bandage, and, like I said, she's doing great. But I'm curious about her case in particular because, it seems like a wound that could benefit from laser therapy. But of course, this is a bleeding process when we have envenomation. We had normal coags at that point. So could you jump in there with laser after kind of the acute period had passed?
Yeah, you definitely could, and in
Okay.
fact, there are chapters written specifically on snake envenomations, and it's pretty fantastic to read the benefits that laser therapy can have. And the suggestions is, as you pointed to, not to use the laser right away after an envenomation because, again, there's bleeding, but there's also the venom right there too, and so waiting 8, 12, 24 hours to initiate using that laser, is what's generally suggested, recommended. And then as that wound is healing, you keep using your laser therapy to encourage healing. And it's pretty dramatic, some of the results that have been done. I just think it's fascinating that there is a whole chapter written in many laser therapy textbooks specifically on envenomations.
Yeah, yeah. I mean, it is really cool because I've seen the skin in these patients. I mean, you're like, "There's no way the skin is coming back from this," and it's amazing that oftentimes it does, without a whole lot of intervention on our part, but, I I mean, I can only imagine the benefit we would get by decreasing inflammation and increasing blood flow and kinda getting the vitality of that skin to come back.
Absolutely. Yeah,
So it doesn't
absolutely.
slough and do all these things that it does on occasion, but like I said, fortunately,
Yeah.
she's doing fantastic,
Oh,
and
I'm glad she's healed up.
yes, yeah, it was a little we all got a little adrenal squeeze there for a minute,
I'm
but
sure. I'm
then she
sure.
came around. Oh, um, we've talked about a lot of applications here for light therapy, for laser therapy. Where do you see this going in the future? What are some of the opportunities we might continue to see?
I think honestly, I think it's a behavior change, honestly. It's remembering that I can use laser in this case, and that's why, I said earlier, you know, don't start out too big and think at every single case, I can think of. We're seeing the cases, so we don't have to go out and find cases that we can use our laser. I mean, these are cases that are coming in every day, and so we continue to learn new opportunities for using a laser. So I think as you get your footing, you get your background and comfort using your laser, then you can expand it into other cases as well, particularly in the internal medicine conditions. We're seeing a lot more utilization of lasers for those conditions. So I think that, it definitely has a place there. And of course, we know the incidence of arthritis in dogs and cats. And, I think this is a part of a multimodal approach, and as with so many conditions. So again, I think it's becoming more mainstream, it's becoming more acceptable. I think there's many less skeptics now than maybe there were a decade or 2 decades ago, and so I think the sky's the limit with laser therapy, but again, it's just that reminder, that behavioral change we need to make, and starting with some of those cases we see all the time, building our comfort, and then you can branch out from there.
Sure, sure, learning, I'm thinking how to use it in the case of your goals, like antimicrobial versus inflammation and getting comfortable in those spaces and then continuing to reach into other areas where maybe that same tool that you're using can be expanded to benefit another disease process.
Absolutely. Yeah.
What was the one I was just thinking of? Oh, lick granuloma. That's the one that always comes to mind. I hate treating lick granulomas.
Yeah, they are, the bane of a lot of veterinarians' existence. I do know
Yes.
that, having dealt with those before.
And so yeah, so when I get excited about like, "Oh, in this case,
Yeah.
yes," and then these things that are such a challenge to manage.
Yeah, oh, absolutely. Is it topical therapy? Do we do behavioral meds? Do we try to excise? And nothing ever seems to really, you know, nip
Is
these
it
things in the.
arthritis? Like, is it pain?
Yeah,
Like, what's going
absolutely.
on?
Yeah, and so the really nice benefit is that there are studies done on lick granulomas and what with laser. And laser is helping to heal those lesions, but also you talked about arthritis and pain. We're not treating just one layer, but we're treating the joint as well in that case. And so a lot of secondary benefits to using laser. Yeah, we're treating the primary lesion, but we're treating the underlying cause as well. But absolutely, liquor granulomas, especially because how hard they are to manage, laser therapy
Mhm.
is definitely indicated in those cases.
Yeah, and I think it also goes along with some of the shifts that we're seeing in pet owner behavior of a little bit more willingness to say like, yes, let me come back and do these therapies and understanding the multimodal as opposed to, I need a pill to fix this. And certainly that's still out there and I can respect some of the reasoning behind that. But also do have a demographic of pet owners who say, I want that multimodal care. I want to understand all the different options I have and you be able to balance that. And so I love the idea of being able to talk to them about that and give them more options.
Yeah, I mean, we're trusted advisors, right? I mean,
Mhm.
clients come to us, they want what we recommend, and I think it's confidence and it's making that strong recommendation. I recommend that you do this rather than, well, we could try laser therapy, see if it's helped. I said, no, let's do this. Let's try this. And let's be honest, what pet owner doesn't want to see their animal wearing a pair of goggles?
Oh
Yeah.
yeah, as yes, and the pictures that are so
Yeah.
cute. I mean, even when it's not your pet, I appreciate those pictures
Mhm.
so much because they just I don't know, they brighten my day, make me laugh.
Yeah, it's a great marketing piece too for social media. You put a dog on there wearing goggles. Yep, you're gonna
Oh
gain some
yeah.
business.
Absolutely, absolutely. I wanna dive into the surgical piece a little bit. Where have you seen practitioners using the surgical side of this?
Yeah, that is a great question. So the surgery piece is pretty cool, if you ask me, and we have different accessories that it can be done with. So used commonly for superficial lesions, I call them those dirty procedures, but also mass removals, for example, eyelid margin removals, those types of things, protecting the eyes, of course. But some of these devices that have more power to them, which a number of our devices do, you can go into the abdomen, you can go deep, and you can spay an animal. You can do a cystotomy if you need to. You could do a splenectomy if you needed to. So a lot of different indications for that surgical laser. And what I really like about this machine is you start with a therapeutic laser and you literally, there's a program, you literally press buttons and it converts it into a surgical capability. And then you have a surgery accessories kit. And then when you're done the surgery, you press a button, you flip back over to therapeutic laser. Okay, I'm going to laser the incision now. And so it's such a versatile piece to have. And we do have a lot of veterinarians that are asking specifically about the surgical kit.
Yeah, yeah, I'm thinking especially when it comes to mass removals and things like that. Are we talking primarily like a cutting capability, or is it like
Mhm.
cutting and coagulation?
It's both, yeah, cutting and
Very
coagulation.
cool.
Yeah,
Yeah,
and
that is so nice to be able to kinda, like, go around your outline and just say, like, "Now I'm gonna remove this."
yeah,
I don't like
really
to the abdomen. I will, but and so I love the
yeah,
idea of being able to do that, but less
yeah,
excited about those applications, but man, a mass removal is that's
yeah,
such a nice idea.
and the other thing too, those brachycephalic airway dogs, I think it's
Oh, yeah.
BOAS now is the term.
Mhm.
So, stenotic nares, you can use a laser for that, but also you can trim that elongated soft palate too. And you
Yeah.
get minimal bleeding with this too. So visualization is better and, less chance of aspirating, and less inflammation as well. So, a lot of different benefits to using that.
Absolutely, man, the sky's the limit, and, there's definitely a demand for something like that, and, doing specialty surgery is not always an option, so, with the
Mhm.
caveat of course, if you're set up for that safely, the idea of being able to offer that more widely and, like you said, minimal bleeding, so we're not seeing as much risk of obstruction and things like that sounds
Right.
and then, like you said, you can go back to therapeutic, and so reduce the inflammation, reduce the swelling, and hopefully the chances of an upper airway obstruction as much as possible.
Right. Yeah, and our devices, are portable as well. So, I know a lot of, ambulatory veterinarians, really like that. They can have it at their brick and mortar. "Oh, I'm going out in the truck. I can take my laser with me," so we have that versatility as well.
Yeah, yeah, so many opportunities. Well, Ryan, thank you so much for joining me and for talking about all of this. So many options for using this, opportunities that I really hadn't thought about a whole lot before this conversation, and I love the idea that there are so many applications and they can really again, give us more options, fit into that multimodal treatment plan for our patients. So thank you again for the conversation. Did we touch on everything? Is there anything we left out?
Yeah, no, I really appreciate the time. It's always fun to do these because education is at the heart of what I do. So I just wanna thank you for the time, Cassie. I mean, this is fantastic. I had a lot of fun too.
Yeah, yeah, absolutely. Absolutely. We'll keep our ear to the ground and as the opportunities continue to expand, then hopefully we can continue the conversation.
Fantastic. I'd love to.
Well, Dr. Mackenzie, thank you so much for joining me and for the great conversation. I really enjoyed it. A big thank you to Indiva K Laser for making this episode possible. Thank you to all of you out there who tuned in. I hope you learned as much as I did. If you did enjoy this episode, please leave us a 5-star review wherever you get your podcast to help other veterinary professionals out there find this episode and find other great content that we're continuously trying to put out there. For more episodes, you can click on the education tab on the VetFolio website or find us wherever you get your podcasts. Let me know your thoughts on this episode and all the ideas you have for what you'd like to hear in the future by reaching out to me at dvm@vetfolio.com. You can also find me on Facebook at Dr. Cassie DVM, or we can connect on Instagram at dr.cassie.dvm. And remember, if one animal is better off because of you today, it's a great day.